Hi.
I think we're gonna now stop presenting the first panel and we're gonna start.
Hi, Darren.
Buenos días.
Hi, Darren.
Hello.
Hello.
Oh.
Well, hello everyone. And thanks for joining today, the first edition of the D4A Pulse. This is going to be a monthly event we're going to hold, well, on different dates, but just making sure that we can catch up on the most interesting developments in the blockchain space. I thank you all for joining me here today. Unfortunately, one of our speakers, Joan Ribas, is unwell today, but we have Joan Jou, also from Chamber of Commerce of Girona, to take his place. So thank you very much, Joan, for making it. I know it was a very, very short notice, so highly appreciate it. And today we will have two panels. The first one is going to be dedicated to Obrir Girona project, Open Girona, where we're going to discuss how we're going to pilot the first COVID pass powered by blockchain here in Girona city. And the second panel, which will follow at 4 p.m., will be about enabling the role of blockchain in digital pass framework. And now, let me start by asking our speakers to briefly introduce themselves. And if I may ask Salome to go first, and then Darren, Joan, and Kirze to take your turns, and I will close the round.
Well, thank you very much, Vasilisa. Thank you very much to everybody to be here today. My name is Salome de Cambra, and I am a medical doctor by training and specialized in public health. And I also have an MBA, and I've been all my life working in the healthcare arena, let's say healthcare arena, which is not medicine, and I haven't practiced. So I've been working for the healthcare industry and the administration, and doing a lot of consulting and other kind of programs and projects relating health administrations, patients, other entities like pharmacies, medical associations, etc. And well, that's it.
Thank you very much, Salome. Darren, can I ask you to say hi from all the way from Singapore?
Absolutely. Thank you, Vasilisa. So my name is Darren To, and I've just been appointed the CEO of AOK Pass. We've been around for about a year, since March, working with the International Chamber of Commerce and great organizations like CBCAT to try and find a solution for digital health passes to support recovery and return to work, travel, and play. I'm a lawyer by training, but I've spent the last 10 years or so deeply involved in a number of tech startups. I've advised about 1,000 blockchain startups in the last few years, some of which have been very successful, but none as amazingly interesting and dynamic as AOK Pass. So looking forward to hearing all the panelists.
Thank you, Darren. May I ask Joan now to present yourself?
Well, thank you, Vasilisa. Well, my name is Joan. I am in the IT companies from so many years ago. And last year we started a project with blockchain, and we believe it's a great future for this newest technology. And well, I'm very happy that when I can see that in Girona have established its headquarters in blockchain Catalonia.
Thank you, Joan. Thank you once again for making it on such a short notice. We really appreciate you to be on this panel. And finally, I want to ask Kirze to represent himself. Kirze is the president and leader of the Blockchain Center of Catalonia. So Kirze, word to you.
Thank you, Vasilisa, and to all the speakers and attendees. Well, I am Kirze Salomó. I am entrepreneur the whole my life. The last 5 years, I've been in the more related on the blockchain space. And now, just some months ago, I became the president of Central Blockchain of Catalonia. And I am focused now mostly to this job. Okay, and very happy to be this afternoon here to explain the project Girona.
Thank you very much. Well, and as I said, I'm going to close the round. My name is Vasilisa Marinchuk, and I'm a director of D4A, and also I'm International Relations Director of the Central Blockchain of Catalonia. So it's my biggest pleasure to work with Kirza side by side as well, and actually with many people on this panel as well, because we are all involved in that project. So my background is very diverse. I also have an MBA from the IE Business School. I've been working in many, many industries until I discovered the blockchain space for myself, and it became a real passion. And it is my greatest pleasure to lead this panel today. And thanks a lot for everyone who joined. So Abrir Girona, or Open Girona, if I may say in English, is an amazing and interesting project. To put on rails such a thing like Abrir Girona is not an easy task, and it takes a lot of collaborative effort to do it. But of course, there is always someone, what must take the leading role and connect all the dots. And in this case, in the case of Open Girona, this role was taken by the Central Blockchain of Catalonia. And Kirza, you've been one of those who was pushing a lot for this. So that's why I would like to open this discussion by asking you to walk us through a bit of what is Open Girona pilot, how the project has started and evolved.
Well, yes, there is the start of the Girona, Open Girona, has been a little curious because let's say that we've talked with the president of the Chamber of Commerce of Barcelona. That he was very, Joan Canadell, was very worried about the economic situation in Catalonia and in Spain and in Barcelona, because our GDP is very related to the tourism. It's 20% of our GDP is the tourism. And let's say that the Chamber of Commerce was worried about that. And also our Minister of Digital Policies, Mr. Jordi Puigneró, they both said maybe the center should look around the world what is happening about the digital passes, about the vaccine, and related to blockchain, and see if that can be or could be a tool to open the economy. And we began this process. We go around the world, let's say, and we met several standards that were the people working on, and very interesting standards. And finally, when the job was really, finally, we understood that the ICC, the International Chamber of Commerce, that is an institution where we belong as chamber. The Chamber of Commerce of Barcelona is member of this ICC institution. These people has developed a standard with the company AOK Pass, and we said, okay, we have a software there, and we look into this software, and we like it. We like it because it was with the idea that we had of privacy by design, first privacy, and this question takes our attention, and we decided to make an agreement with this with the ICC and go for a pilot of this software. and that's it. After turning around the wall, we find that we have that at home. No? It's a little curious, the beginning. And we began with to structure this pilot, and I think what is bringing the value that is bringing the chamber, the center of blockchain of Catalonia, the CBCAT, that the real value is the architecture of deployment, that I think is a nice architecture of deployment that can help a lot the rollout of this solution.
Can you just give a little bit more idea of this architecture of how the project is structured? Because
well,
it's actually not a very common thing. It was quite bright idea, I would say.
Yeah, because we have a real defeat here in Spain, in Catalonia, but also around Europe, and I think around the world, with the traceability apps. The Spanish government has issued an app, a very interesting app, about to trace the contacts in the beginning of the pandemic. And that has been a real defeat, a catastrophe. This app has not been used. And when you think why, it's because the app was well done and was a good app, and a good idea. But the question was the deployment, because an app is not only to put this app to the App Store or the Play Store, and that's it, and the people will download and will go. That is more complex than that, and you need to make engagement to the citizens, and the people needs the people. It's necessary that the people wants to use it, and that was the reason to find and to look for an architecture that makes that more easy. And we are using as the first layer of this architecture the chambers of commerce. In Catalonia only, there is 13 chambers of commerce. Around Spain, I think near 80 or something like this. It's a real, a nice network of business organizations. And that is the first layer of our deployment. And a second layer, and very important layer, and is the center of this deployment, is the pharmacies. In fact, only in Girona, that is a small town, there is 40 pharmacies, but in Catalonia there is 4,000 pharmacies. And the pharmacies is our trustee, is the center of our deployment. When is the institution that will give trust to your health status. And that I think is key for this deployment, because we are this capillarity that has the pharmacies around the territory will make very easy to roll out the application, the app. Okay. That is the architecture. There is also more things, but mostly that is the biggest and important things. These two layers of territory.
Thank you, Kirza. I think it's pretty clear for our audience right now how the project is structured. But now, basically, yes, we understood the layers. But again, the heart of the project, again, is the technology. And in our case, it's the ICC AOK Pass. So Darren, I know that you already had some great trials and pilots of the app within and outside of Europe, but I guess for you it's also like something new to roll out the pilot in the city, like not just in the airport, but in the city. So can you tell us more about the technology you are using and how it works and how it can be applied in different scenarios? Yeah.
So Kirza touched on a lot of really important points, and I'll try and unpack some of that. But really the key to adoption is having not just an app, but a system that people are willing to use. You can build the most sophisticated system, and if it's too difficult for people to understand, then it just won't get adoption. So we're very proud because over the last 12 months, we spent a lot of time and effort to build network in order to establish a global footprint. So to date, the operational pilots that we've deployed for airlines like Etihad, Air France, a number of French carriers, and a few airports around the world, including Rome, Paris, Charles de Gaulle, SFO in San Francisco, LAX in California, and a bunch of others. We are very fortunate to be the most operationally advanced solution. So what that means is, because we've done a lot of very complex pilots, particularly in air travel, which involves several layers of complexity and so many different stakeholders in a single country, let alone cross-border, that we've had the benefit of a lot of really valuable experience, both in developed countries like in Italy and France, but also in developing countries like Pakistan, where you face all kinds of unforeseen challenges like lack of internet access, low smartphone penetration amongst the travelers there, who are mostly migrant workers going into the Middle East. So bringing that all together, you know, when we were first introduced to the Catalonia blockchain team, we were impressed by how ambitious their pilot was and the scope of it, because there is really nothing like it in the world right now, where you have not just a large population for an entire city, but a range of different use cases. So you'll see different solutions out there, like to travel pass, for example, which is really just restricted to travel, the travel use case. What's really exciting about Girona is that you're talking about allowing local businesses like restaurants, cinemas, all kinds of economic activity to get back to work and to allow people to enjoy frequenting, you know, vendors and businesses that need their support to survive. And not just that, you know, the really important community-based events like football matches or any kind of community sort of gathering in public spaces. All of that really requires a way to manage your risk and to ensure that the health and safety of your population is the highest concern. And in doing that, of course, you know, there are a few things that are very, very important to us as a company, particularly because we're founded by the ICC, which has a really established mandate for the greatest possible inclusiveness. So really democratizing access to the solutions that will bring us back to work, back to travel, and back to play. So what's really key, and what we built into it from the beginning, building on top of that inclusiveness, was allowing people to verify that they had a particular health status without breaching the privacy of their personal data, which is sacred. It's very, very important because, you know, solutions that require centralized, non-distributed systems really just mean that you're surrendering your private data in order to access services and community events and all that stuff, which are really basic human rights. So by allowing individuals to maintain their strict privacy, so their personal data never leaves their mobile phones and is never exposed by our system, seen by us or seen by any third party, to allow that verification to happen, we're really giving people confidence that they don't need to compromise on their privacy in order to return to a pre-COVID world. But having said that, you know, it's a post-COVID world, and the reality is that the pandemic is creating chaos, and infection is a very real risk and a great risk to the community and to the health of many vulnerable groups. So you have to have a secure system, a fraud-proof system that still allows public authorities and businesses to ensure that the people coming into their venues, into their sites, at least meet, you know, a minimum health status standard, so that they're not a danger to themselves or the people around them. This is very important for travel, where you're entering confined space, but any local business like a restaurant or a cinema or a football match where you have thousands of people, it's really important that you manage your risk and ensure that, you know, everyone going there has the confidence that everyone around them is also COVID-free. So, I mean, that was a long answer to a short question. The technology is blockchain based. We rely on sophisticated hashing algorithms. All that is the technological magic that lies behind it, but really our app is very user-friendly and intuitive. You don't need an instruction manual to pick it up. You can download it today on the App Store or Play Store, or even the Huawei Gallery Store, and you can start using it. Now, the system and the network that we need for this to truly be a global solution is still a work in progress. We're very advanced and the most advanced operationally, but you can imagine a truly global solution requires so many stakeholders. And what's really valuable about the Girona experience is that there'll be so much incredible data coming out of it in terms of what works and what doesn't work, what's effective and what's needed at a city level, and eventually, you know, to expand to country level and cross-country level. The EU, as you all know, recently came out with a very ambitious target to have a digital health pass in place by summer. That doesn't give them a lot of time because they haven't got anything right now. But, you know, the hope is that solutions like ours, having, you know, the experience of pilots like Girona, will be able to show them that there's a successful model and an effective model to allow businesses to get to work, to allow workers to go back to work, to allow people to you know, restart travel and to restart play, going back to concerts and live events, all of that great stuff that makes life worth living. Hopefully, AOK Pass with partners like Girona and the Blockchain Center and all the various chambers of commerce, not just in Spain, but around the world, can work together to create that network and to create the experience and to allow the EU and other countries and regions to see there's a solution here that works, it's ready to go. We just need people to step up and to join us and to partner with us. And hopefully we can move towards a safer and more efficient recovery.
Thank you, Darren. That's a very, very, I would say, an inclusive answer. You touched base on many important parts. But there is one question which I think is important to ask, just to make sure that people do understand how that works. Because you are saying that the AOK Pass relies on the blockchain, right? And as we know, the blockchain is an immutable system. It keeps all the records. It's easily traceable on certain points, right? Then it's kind of provide the privacy at the same time. And at the same time, you're saying that the information doesn't leave the phone of the person. And I think that this is something you would like to explain better for our audience to understand how that two things work. Yeah,
I'll try to simplify it. So basically, when an individual goes to a pharmacy in Girona and they're tested and they get a test result, the information from that pharmacy is converted into a hash value. Now, a hash is like encryption, but it's one way. You can encrypt something and de-encrypt it. When you hash something, it is impossible to re-engineer the information it derived from or the individual to which it relates. So it achieves privacy. Now, when a person creates an AOK pass on their mobile phone using their personal data, an exact replica of that hash is created. So when our system is queried, when someone presents the AOK pass, which is basically a QR code, it calls to the blockchain and to our attestation servers, and basically it looks for a perfect match. If it finds a perfect match, which will be the clinic's hash, then you have an AOK pass, which is valid and current. So basically, the pharmacy that already has your personal information, your health information, and is responsible for keeping that safe, only transmits a hash. Your phone does exactly the same process, and that allows the verification bridge to be achieved. And that tells whoever's scanning your QR code, using the app as well, that this person has the documentation that they claim, which in the case of Girona is either a negative test result or a vaccination record. It's a lot more complex than that if I tease out all the technical details, but that's essentially the magic of it. It's quite simple.
Yeah, I mean, thank you very much. I think that's exactly what was needed to be said to explain how the thing's working. And I hope we didn't go too much technical. And before we go on, I would ask, I know that people who are listening to us right now or will be watching this video later, maybe not very much familiar with what is the city of Girona, where is it even, right? So the first, what I would like to ask from Joan is to give the audience a bit of perspective on what is Girona city, its economic, business, social dimensions, maybe, just, so the people understand what we're talking about, right? The scope.
Well, the region of Girona has 800,000 people, which doubles during the season of June to October. It's located in the north of Spain and next to south of France. It accounts for the 10% of Catalonia economy and the 25% of Spain. To date, Pandemia had 7,000 companies, 19% at fewer than 10 workers. A highly diversified economy with very powerful tourist, trade and service sectors, and a small and medium-sized industry very open to the export. The affectation of pandemic, unfortunately, have greatly affected the business fabric.
Okay, thank you. And John, another question would be more, say, in accordance with Girona project, there are several types of the businesses involved, and you're like representing the business from the Chamber of Commerce. So what particular areas are touched by the pilot, and what do you consider to be most important there?
Well, Girona representative economy ecosystem is of our country, and therefore doing a pilot test in this city provides strong guarantees that the future development will work as the similar way. This pilot must be similar possible as what will be at the future implementation from the territory. In this difficult time for many economic sectors, it will represent both of demonstrate that Girona and its surround is really to gradually return to normality with maximum security. It's important to mention that the main economy and social sectors in the city have joined the project, in particular the commerce, gastronomic, hospitality, sports, theater, and music sector in order to carry our various events, so as soccer, baseball, rugby games, play music, concerts, a commercial fair, and etc.
All right, okay. I mean, that's very important that we actually trying with very different type of businesses, right? From the small restaurants and, like you said, cinemas or fairs to the grand events like a football match. Because even if it's the local Girona Football Club, which is, I think it's a second league, or I'm not very good at football, but it's still, it brings up thousands of people on the stadium in the day of the match. So that's pretty impressive. But anyways, so besides the economical part of the project, the business part, the health considerations are probably one of the most important here. So Salome is here with us for this reason. And she was heavily involved in the health authorities negotiations, and she was working side by side with the pharmacies. So Salome, can you share with us your experience on that side, and how ready are the people to use and rely on the technology in the pharmacies themselves? And, it's more or less a very, like, I don't know, not very much innovative industry, right?
Well, I'm not. I don't agree that it's not innovative. There is a lot of innovation.
But the pharmacies, they've been like, 10 years ago.
No, I understand you. No, one thing that the COVID has brought to the healthcare system is that, you know, the technology that was taking a long time to get implemented, it's been rushed into. So it has made changes, but I'm sorry, but there is something now, this telephone around here making noise. So for the healthcare system in general, the COVID crisis will make a now and before, because there are many technologies that have been implemented, and they are here forever. But we are going to leave this on one side because, you know, we can speak a lot on that and forget about this project. That is, I think it's you know, really the point of this conference. So what is the reaction of the people involved in the healthcare system to these technologies? And the first reaction of everybody when we speak this program is, the reaction is very positive. It's very positive because we really need it. I mean, the healthcare system deals with other projects, other problems that are not COVID. You know, there are a lot of other diseases that are staying. They have been developed, you know, mental health problems and many other cancers and other diseases that are not attended because this is stopped of the activity because the COVID. So everybody is really, you know, willing to accept and innovate in this sense. However, when it comes to do it, then it comes all the barriers, the inner barriers that have all the decision makers in the healthcare system. And when we speak about the decision makers, we speak about administrations, and we also speak about the pharmacy that is selling their products in the pharmacy. So healthcare professionals are afraid also because the uncertainty of the situation. So in general, they are afraid of making decisions that may release and make it be too optimistic, and you know, and getting problems out of this. So they have whenever they see that there can be a problem, they are conservative. They are trying not to get in trouble in this sense. One other important thing about healthcare professionals is that they are reluctant to not comply the rules they have to follow, because there are some rules that are set because those rules ensure that they comply with their responsibility. And we have a very recent case right now, that, for example, for the vaccine of AstraZeneca, is all the scientific society is claiming not to stop vaccinating with this vaccine, but the authorities have stopped this vaccination because they want to be sure that they don't run a risk. So this is an attitude that we see in most of the healthcare decision makers, but we have to deal with this. That not all of them are so conservative in this sense. I'm not sure I have answered your question.
Well, yes, partially, definitely. But the thing is, if you just kind of a little bit elaborate, especially you've been talking about the health authorities, and we know that WHO, the World Health Organization, is also must be actually a bit orthodox on certain decisions. They must make sure that whenever they introduce something or implement something, be it a vaccine or a technology design or a facilitation, it's actually serving the people, and the risks, if we cannot make it a risk-free, at least we minimize the risks to the lowest level possible.
Yeah,
right?
it's
Absolutely understandable.
Yeah, and since information, is, I mean, the situation is really changing one day to another. When we begin with this project, we had the new strains coming from the United Kingdom and South Africa. Everybody was, a little bit scared. What's gonna happen with this? It will be, more aggressive virus, and we will be like. Last year, March, would be replicated this year. They were afraid about that, and it was normal to be afraid of that. We've seen that it doesn't happen. It hasn't happened. So now everybody is very much optimistic, although people is afraid to be too much optimistic. but still.
Okay, thank you, Salome, very much. I mean, overall speaking, we are very much lucky to have a very representative panel here. And that's why my next question will be directed to all of you. As in this way, I trust we can achieve a more rounded vision on the pilot. So can you share with us what are the most important considerations which must be taken into account when running such a pilot? From business, from healthcare, from technological and organizational point of view. So in terms of the, let's say, healthcare side, as soon as we've been already talking with you, Salome, so what would you say is the most important for this pilot to be successful, for it to happen?
Well, now we are in a situation where I think we are in a very nice situation right now, because we were looking to be in a sandbox situation to make this pilot. And now we are in the typical healthcare sandbox, which is the research project. That was something that we didn't want at the beginning, but we have realized that this is the perfect situation to demonstrate that this project that is safe and provides benefits. And once it's provided, and you have to prove it in a research, then you are in a much better situation to expand this idea, and then you don't have to prove it again, because you have already proved.
Correct. So you have to be backed by data, basically, right?
Exactly.
To create.
Now we are in the research arena, and this is the right place to demonstrate that you are safe. And once you are safe, this is the most important thing. Then, of course, you are also effective in what is the objectives of the project, that is open the life again.
Right. And Darren, from the technological point of view, what are their core takes or core things which must be implemented? Like, what are the considerations for you?
Look, I think operationally, what's essential to success is a team on the ground that can coordinate all the different partners and stakeholders. So without Queze, without Salome working with the pharmacies, and Queze with the local businesses, and Joan with the chamber and their affiliates and members, it would be impossible for our team to achieve this from Singapore, communicating with people over Zoom. There need to be bodies on the ground, talking to people, training them, and making them familiar with something which I'm not sure if pharmacies have had to deal with blockchain or with mobile apps for digital certification before in Girona. Certainly, it's not the norm in the rest of the world. So you need people who can execute. The technology, of course, you need a solid platform, and you need developers who can maintain it, in an operational production-ready app. But without the operational team to make it happen, you can have the best technology in the world and nobody will use it.
Mm-hmm. Yeah, that's exactly what Kirza was referring in the very beginning. So Kirza, again, from the organizational point of view, what is for you the most important considerations? Kirza, you are muted.
Sorry. Our goal in this project, in this pilot, our goals, because there is set different goals. But the first goal is to test and to fine tune the software to help the team of AOK Pass to fine tune, because the software, you know, always is not easy to fine tune. That is the first one. And also to be sure that this software will be as much as scalable as possible. Because when we roll out that in a country level, well, Catalonia is a small country, but there is bigger countries than Catalonia, and then you need to be sure that this scalability is possible. That is another goal. That is the goal of the software. The other questions in terms of organization for us is to be sure that we have a team, that then this team could be the framework of the next level rollout. If we plan a new rollout from this pilot, you need to use the pilot to get this team that will be this framework for the future rollout. That is the other goal, to be sure that we have this team in place because also there is a calendar and an agenda question. All these must be, this rollout should be, if it's possible, done before summer here in Catalonia, because the summer season is very important, and we need to be that on place on the whole country, and that is also the challenge. Do that in so few time and weeks, compressed. That is to manage this stress that is caused by this short agenda is also a real challenge. Okay?
Right. And finally, I mean, Joan, from the business perspective, what are the key considerations for you?
Well, for us, it's really important to back to secure normal life. But also it's very important for us the preserving privacy from the people. You know, is this return to normal life is we can't do it without losing our privacy. You know, and for us it's really important. Is the enterprise are important, but it's important to the people, you know.
Right. Yeah. I mean, there cannot be a real compromise here. It's better to make it good rather than super fast, and then we will have to deal with that for a long time. And regarding the challenges, because Kirse was mentioning the challenge of short time, which is true. Maybe from your perspective again, Darren and Salome, what challenges did you meet during that pilot in particular? Because I know that the other countries, the other cities, the other blockchain centers or other centers, they trying to do something similar or replicate or whatever. So maybe you have some, you know, advice or like, look at this, be patient, be very focused on certain things. What were the challenges or remaining challenges which you see for pilot like Open Girona?
I mean, sure. From my perspective, it's always better to have more time to get things perfect. But in a situation like COVID, where businesses are going out of business, people can't go back to work, people can't travel, tourist season might be a disaster for many really countries and regions dependent on tourism. You know, perfect can be the enemy of good. So really, I won't say that that all our pilots have been perfect, but they've definitely been incredibly valuable learning experiences to get us closer to perfect. Girona is one of those. I mean, implementing for an airline and an airport for people traveling by air is very, very different to trying to implement for their citywide use cases. And the challenges are very real. And I know that our development team has been very challenged to make sure that the specific needs of Girona and the teams there and the pharmacists and the users needs to be built into the platform so that it works as you need it to work in Girona. So, customization always creates possible risks because when you change something that works, it can be challenging and it can create, possible issues. But the great thing is that we're working with an excellent team on the ground. Our developers are world-class. Our technology is proven. Whatever happens in Girona, it will be an incredible experience and learning experience, not only for implementation across Spain, but the rest of Europe and the world. Because as I said before, there's nowhere else in the world doing this right now on this kind of scale, outside of China, which is, as you know, not a privacy preserving system. People are giving away their privacy entirely to get back their ability to travel or to do things. That can't happen in many countries like, throughout Spain and the EU, Australia, Singapore, United States. Most of the developed world really, really values their privacy and needs a technology solution that doesn't require you to surrender that. So, whatever happens in Girona, I think a lot of positives will come out of it, a lot of incredible data, a lot of really valuable experience to help us to that next level deployment across countries and across the world.
Okay, thank you, Darren. Salome, you wanted to add something?
Well, yeah, I have a couple of things. Well, first of all, have a robust technology like this one that really can ensure privacy. And I'm not going further in technology because this is not my strength at all, but this is key. And if it is not strong in this sense and it's not private, just don't even think about that. Then keep finding solutions. There are a lot of troubles. There are a lot of barriers putting this in place. Keep finding solutions. Be flexible because the reality. The reality changes every week, and even the evidence, the scientific evidence, and also the attitude to this evidence of the decision makers changes every week. And manage expectations. That's very important, because these programs create a lot of enthusiasm, and it's important to balance the expectations about taking into account what is the reality, because the reality is very unchangeable, and then sometimes you expect you can go faster, and you finally you're not able to do this as fast as you expected, and it's important to take it into account.
I would also just say from my end, because I was somehow involved in the Open Girona project and I observed a lot. What I find most interesting and most important is the level of collaboration which exists for this project between different entities within country and outside the country, the will of the people to push forward and find the compromises sometimes. Working harder to deliver the best results and take into considerations the, let's say, the fears or the worries of the other party, and implement it, so to make sure that everybody are comfortable as much as possible. And on the contrary, not on the contrary, but again, we said that this pilot is done for a certain purpose. Not just pilot or pilot for research, even though it will provide a lot of data. But what is important, it's actually if it will go further to Catalonia, Spain, to Europe, right? So in your perspective, and this is the question for everyone before, because we're already like starting to wrapping up a little bit, how do you see the probability, the chances for this pilot to be a very good ground for the rollout further? And what needs to be done for this to happen, maybe? And I would ask Kirza the first, because he was mentioning that before, and I think that's the whole idea of the pilot, basically.
Well, let's say that the probability is very high, because I am agree with Darren that there is no other solution so advanced around the world. And I think it's very high that the Girona and the rollout of this solution will come the next weeks all around Catalonia. But also, I before finishing, because you said you are wrapping you're closing the panel. I want to say a big opportunity that is on the table, and I think that Girona, that the team of Girona, you and yourself, Vasilisa, and other people in the center of blockchain, is the big opportunity to build a global standard, a world standard. And I think that our contribution on that should be as much as possible, because the future of these kind of solutions is if we reach this global solution as soon as possible. Okay, and I think that what we are doing here in Girona is to share to all this community that is working for these standards, because the things that we will learn out of what is happening here, I think can enrich a lot the building, how we are building these standards, because these standards are built in an office. It's all theoretical. What will happen in Girona will bring this background that these standards will need to be built, and I think that that is an important part also to take an account of Girona. Okay, and the possibilities of success are very big, I am sure. But I think that is a solid project, and we'll see the coming weeks that is we will going on. Yes.
Yeah, I'm sure that more people will be following the developments in Girona and how it's happening. And I mean, with all the good and bad parts, so that which need to be fixed, we're also learning. That's understandable. I think that Joan wanted to also add something regarding the future for the pilot to be something bigger.
Yeah, for me, blockchain is most the technology. You know, for me, is a revolution. You know, because is the base of where we can build the future. Years ago, when internet, when we start with internet, it looks just technology, and then we can see that it's much more than this. Internet is really very important, but for me, I think that blockchain can be much more revolutionary than internet. It's
Difficult.
say this now is maybe somebody can think that it's well, that's not so big. I think that it can be really a big thing, you know. That can change. Blockchain can change money, can change political, can change how the way to relation with the people and people with enterprise banking system. DeFi is much more than technology. I think we are very excited with this project, Darren. We are really happy with your product, and we hope that most of enterprise in Girona can adopt this technology and follow this way.
That was very funny in the moment when Salome said it's difficult, right? Because the technology is not easy. That's very much true. I mean, that's something a little bit more advanced, but I think that's the beauty, and I will actually pass the word now to Darren, that actually the technology is now serving the people, and it doesn't ask them to learn actually like all the depth and, you know, tech and anything. It's like, you don't need to know how the internet works to send an email anymore, right? And that's the core. But I don't know what you think about how are our chances to go with that further, to roll it out for Catalonia, Spain, Europe, I don't know, the rest of the world.
Look, it's essential. It has to happen. And the really important point that Salome and Joanna made, and Koza too, is that we're talking about a really sophisticated technology, but what we're really talking about is empowering human beings to going back to doing the essential things in life, not just work, but, you know, social life, community life, live events, gathering in crowds, you know, being able to walk around without fear of infection or risk to your health, or putting other people at risk because you may be infectious. All this stuff and the technology behind it, you're absolutely right. I don't think about the technology that makes my phone work and the way it makes my life better. It just does. And, you know, that's the magic of blockchain as well. People don't need to understand it in order to benefit from it and to really improve their lives based on it. And I think Joanna's right. It will revolutionize the world. And I think a lot of people still a little bit suspicious of blockchain because it hasn't had a really powerful global use case that didn't involve finance and money. Now that we've got a use case that involves supporting human beings and communities getting back to normal life, I think people will recognize it for what it is, which is a transformative technology, something that can really change the way we interact with each other, as John says, with enterprise, with our banks, with every third party. It really creates that incredible new technological platform that will improve society and allow us to move forward.
Thank you, Darren. Well, thank you, everyone. We are almost done. We have like 3 minutes left before we will have to move for another panel. So I would ask if you have any closing remarks for our audience, some thoughts, whatever you want to share, or just say bye.
Well, I would really like to imagine my life with blockchain. You know, the same difference that it was with internet. So I'm eager to learn that.
That's a good one.
In the future.
No, for me,
how will be my life with blockchain?
To me, only to thank you, Vasilisa, very much from the Center of Blockchain Catalonia for your first D4A pulse. I think that will be very useful chat and talks the next coming months before the big event. And thank you very much for your pulse.
Thank you, Vasilisa. Thank you, Kaze, Joan, Salome. Thank you for including me, allowing me to contribute. My parting thought is just watch this space, watch what happens in Girona. I think it will be incredibly important for everyone, everywhere.
Thank you. John, anything to add?
Well, no, nothing. Only thank you very much to everybody.
Well, dear panel, thank you very much for joining us today. I think we a little bit uncovered for the rest of the world, for anyone who is curious to learn more about the project, what is Abrir Girona, what is Open Girona. I mean, just few words that Center Blockchain Catalonia is very open about the collaboration or sharing information on this project. It's absolutely transparent, not private data, no, but about how the things are deployed and what are we trying to achieve. So you can always get in contact with us or become an observer or anything. So there are our emails, which you can always write to us and reach out, or in social media. We always pay attention. Once again, thanks all for joining for a very interesting discussion. We're gonna do a little bit break for like about 1 minute, and we're gonna start the next panel. So stay with us.
Okay, bye.
Thank you.
Bye.
Adeu.
Thank you, everyone.